Well, thank you to Adam and the rest of the GoEd team for inviting CRN to be part of today's and the last 3 days events. I'm going to start at the end with the bottom line, which is that the targeted use of omega-3 dietary supplements can reduce healthcare costs in the US by hundreds of millions of dollars. So now that you all know that, you can stop paying attention. But if you want to know how do we know that, then please listen to the next few minutes. I'm a scientist, so I've been trained to always ask, well, where is the data? Show me the evidence. So I'm going to talk today about a report that the CRN Foundation commissioned back in 2013. The CRN Foundation is the educational foundation of the Council for Responsible Nutrition and aims to educate consumers, researchers, and healthcare providers about the benefits of dietary supplements. And this report was undertaken by a firm called Frost & Sullivan. So we know that Americans spend far too much money on healthcare, and a disproportionate amount is spent on addressing preventable diseases compared to the amount that's spent on preventing these diseases from happening in the first place. And everybody in this room knows that, at least for omega-3s, as well as for other dietary supplements, that there is a wealth of evidence showing that they can help to reduce the risk of disease. But what if they could help to reduce healthcare costs as well? And that's what we hypothesized in the study, that the use of selected dietary supplements in certain cases could reduce the risk of disease and also reduce healthcare costs, saving the healthcare system a lot of money. So although today I'm going to focus only on omega-3s, the report that we have, which is available online on our website, crnusa.org, includes 8 different dietary supplement and disease risk relationships. So they're all here on this slide for you to take a look at, and you can read the full report at your leisure. And the reason why we chose these 8 different relationships is that they were established relationships between the substance and the disease risk, and we were able to quantify the reduction in disease risk for all of these. The research took a 2-pronged approach, and the first part was to determine and quantify the disease risk reduction from the use of supplements. So this is pretty straightforward, undertaking a review of the published scientific literature, identifying the qualified studies, and then looking at the amount of disease risk reduction. So you're going to see a lot of numbers in the next few slides. The good news is you don't have to memorize any of them because you have copies of the slides and you can see our report. The reason why we have so many numbers is that our target audience when we were developing the report were insurance providers and legislators and policymakers, and they all want to see every single number that backs up our statements. So we're focusing today on coronary heart disease, and it's a very prevalent disease in the US adult population. And 16% of adults over the age of 55 with CHD will experience a CHD-related medical event each year. So this includes chest pains, heart attacks, etc. And the average cost of addressing these events, either through an ER visit or an inpatient procedure, is really expensive. And this doesn't even consider the secondary costs of lost work time, long-term care, long-term medications, childcare costs, transportation to and from facilities, etc. So we're being very conservative here when we estimate the costs. And so looking at projections of 2013 to 2020, these costs really can escalate. And the reason why we didn't stick to just 2013 is we knew that once the report was published, it would be outdated pretty soon. And we wanted this report to have some legs and to show our target audience the long-term benefits of using dietary supplements and saving money. So in the case of omega-3 fatty acids, we selected a preventive intake level of 1,000 milligrams per day, and this was based on the American Heart Association's recommendation for individuals who already have coronary heart disease. So again, another conservative approach. We didn't look at a wider audience of people who are just healthy or at lower risk. And this was backed up by the data from the studies that we identified from the literature search. So I'm not going to go through the science because it's pretty well established, but through Frost and Sullivan's analysis, they determined a 6.9% relative risk reduction in CHD-related medical events. And so this, projecting out to 2020, results in over 1 million avoided events. So part 2 of our research methodology is to determine the healthcare cost savings. So we're going to take you through this simple formula. First, we have to determine the hospital utilization costs in the current state. So assuming nobody is using omega-3s at the preventive intake levels. From that, we can subtract the avoided hospital utilization costs, assuming that 100% of the target population is using omega-3s, and this gives us the revised costs. But then we have to factor in the fact that dietary supplements are not free, because if they were, we wouldn't all be sitting here in the Canary Islands today. So with that, we have the combined healthcare costs of reduced hospital utilization and the cost of dietary supplement utilization. So let's take a look at some numbers. So if you look at the left-hand side of the graph, you can see the cost of the hospitalization associated with CHD events, assuming nobody is using omega-3 fatty acids. Moving down to the right, you can see that over $2 billion can be saved per year from 100% utilization of omega-3s at 1 gram per day. But then again, factoring in $1.57 billion in the cost of a median cost of 25 cents per day, which still results in a substantial savings of $485 million. But then we have to think, we know that there are some people who are already taking omega-3 dietary supplements. And so what we did was we applied a factor here using consumer survey data that CRN conducts every year. This is from 2012, and this survey showed that 28% of adults over the age of 55 who are at risk are regular users of omega-3 supplements. But this means there's 72% of adults over the age of 55 who have yet to realize the potential benefits of omega-3s. So factoring that in, we still have cost savings of almost $350 million per year. So this is just a brief summary to show you that we have these great infographics available at the website supplementforsmartprevention.org for all 8 relationships that we studied. And we'll just zoom in on the omega-3 relationship with CHD. And you can see some really handy tips that you can download, print, whatever you want to do with them. 25-cent daily costs, over 1 million events avoided per year, how much is saved per year, and then the cumulative savings of $2.8 billion up to 2020. So what does this report mean for those who are interested in reducing healthcare spending? It means what I said at the beginning, the targeted use of dietary supplements, and in this case, omega-3 fatty acids, can reduce healthcare spending. And how can we get this message out? Well, we have to communicate, communicate, communicate. That's why I'm here today talking to you. That's why CRN staff and members have been out talking to legislators and policymakers and insurance providers to get that message out with the hope that dietary supplements, including omega-3s, can be part of government spending for healthcare funding, as well as for insurance plans, and as a perfect segue to Catherine's talk, for employer-backed wellness plans. So with that, I'd just like to thank you all for your time and happy to take questions when we have a chance.